con los terroristas.
The Harlem Shake.
Con los terroristas.
Oppan Gangnam Style. Gangnam Style. 낮에는 따사로운 인간적인 여자 커피 한 잔에 여유를 아는 품격 있는 여자 밤이 오면 심장이 뜨거워지는 여자 그런 반전 있는 여자 너는 선어해 낮에는 너만큼 따사로운 그런 선어해 커피 식기도 전에 원샷 때리는 선어해 밤이 오면 심장이 터져버리는 선어해 그런 선어해 아름다워 사랑스러워 그래 너 그래 바로 너 아름다워 사랑스러워 그래 너 그래 바로 너 지금부터 날 때까지 가볼까 오빤 강남 스타일 강남 스타일 오빤 강남 스타일
Dr. Coffin dictating on patients.
Hey, Dr. Coffin.
Hi, Dr. Taylor.
I've got a patient here, 46-year-old female, no past medical history. Just came in for same day with a cold, and I was just thinking I was going to give her some Flonase.
Did they get their flu shot, their Pneumovax, there's also the hepatitis B and the hepatitis C shot?
Oh, I don't know. Let me pull a practice partner. Well, it's frozen, so I don't know.
Did you prescribe?
I did. Yes.
Just hear me out, Dr. Taylor. Just hear me out, okay? Let me make a long story short. If you have 6 5-minute spots during the day, that equals an established care visit. So we're gonna have to give them their shots today.
Okay, so give them all of those shots.
Yes, we'll do that. So which one are we doing? Tdap, we're doing HPV, Pneumovax, Hep A, Hep B. So we'll call this a 4 then, okay?
Okay. What about the Flonase?
That's fine. We'll e-prescribe that. So
Okay.
we'll make sure that we put it on e-prescribe, okay?
Okay, I'll do that.
Thank you, Dr. Taylor.
Dr. Nixon.
Hey, Dr. Horrible.
Yes. I have a patient here for you.
Hold up. Did Dr. Coffin bring the donuts?
Yes, they're in the back.
Okay, go on.
Okay. I have a 56-year-old patient here with low back pain. It's been going on for a few days. We did an MRI. We found out that it's spinal stenosis. We're going to set him up with Dr. Nixon. Dr. Nixon.
I'm awake. Go on.
Okay. We're going to send him up with neurosurgery to see what they're going to do for him. Dr. Nixon.
Neurosurgery.
Yes.
Mm-hmm.
Do you agree with that plan?
Well, you know 90% of the geriatric population has spinal stenosis.
Correct.
It's only if they have numbness or tingling. Just let them be.
Alright.
Just let them be.
Yes, sir. Thank you.
You sure the donuts on the back?
Yes, they're in the very back.
This is a 30-year-old white female. She has a history of some asthma and some anxiety, so I felt that rib raising would be appropriate.
Oh, that's fantastic. Yes, we need to really get that intercostal system working. We can even use that bladder 10. It's a great point for relaxation. We really need to get those muscles moving.
Good. Deep breath for me. And let it out. Good.
All right, let's recheck. Oh, yeah, that's much, much better. She feels so much more relaxed. Oh, yeah, that's much better. Much more relaxed. You really targeted that mean. Really, really relaxed.
Okay. Well, I think 4-week follow-up would be great.
Yeah, that sounds great. 4 weeks. All right, good to see you.
Nice day, man. Bye-bye.
Hi, Dr. Phillips.
Dr. Owensby. Hello, good afternoon.
So I have a 78-year-old female here for routine follow-up. She's here for just a blood pressure check, and everything's normal. I'm just going to refill her medications if that's okay.
Okay. Tell me a little bit more about the patient. How old is she?
She's 78. She just had she had a...
Look at this. Chomping data at trillions of bytes per second, University of Florida. It's amazing. All right, sorry, go ahead.
Okay. Well, she had a hysterectomy back in the 80s. You know, her kids are grown. She lives by herself at home. But she gets around really well, and really all she needs today is just her medications.
Okay, still sexually active.
I didn't touch that one, sir. I didn't go there. Yeah.
Okay, well, why don't you go back and you can ask a few of these questions. If you need me to see any of your patients today, I'm more than happy to do that. But I think we should definitely get a urine pregnancy test. Go ahead and get it. Iron studies, TIBC, folate, B12, methylmalonic acid, and SMA1. That's Dr. Parrish.
She's here for blood pressure.
I'm not going to try and tell you how to practice. Yeah, but you never know, Dr. Owensby. I've been doing this for a long time, and I'm not trying to tell you how you should practice medicine. I know you're basically my attending at this point. But really you should be thinking about things like if the patient is pregnant or not. If I were you, and I'm not trying to tell you how to do this, I would probably get a urine pregnancy test on the sir.
Sir, whatever you say.
Okay, thank you. Was that okay?
That
okay.
was
All right,
fine.
have a good afternoon.
All right.
Mark that. Next line.
Hi, Dr. Parrish.
Next line. Erase that. Chlorthalidone. Talk to me, Goose.
I have a 63-year-old female coming in with past medical history of anemia and hypertension. Today she's complaining of some weakness and fatigue, and her blood pressure was a little elevated. I was going to do some iron studies. She is on lisinopril already. I was going to add some hydrochloric iodide.
Wait. Now, have you read the all-hat study?
Not yet.
Why would you give an inferior medicine like the dreaded HCTZ? Back in 1983, when I was in residency at Emory, we had a little trial of our own. It was called the SMA1 trial. Are you familiar with that one, Dr. Clark?
Yes.
Why don't you tell me what an SMA1 is?
I don't know what it is, Dr. Parrish. I'm sorry.
It's the good old finger number. Anyway, talk to me, Goose. What else you got?
So I was just going to do those iron studies, maybe get some B12 for her weakness, and then we'll put her on the right down.
Can you even say it because it's such a superior medication?
No, I can't.
Wow, that sounds like a fair idea. You just go ahead and do what you got to do.
Okay.
Next line.
Dr. Parrish, where's your bike?
I left it at the McDonald's.
Okay.